Okay, so we're gonna do an example of taking a blood pressure. So first things first, we wanna make sure we always wash our hands or use hand sanitizer before we do anything with a patient. This patient has been here for about 5 minutes or so, so it's important to have your patient come and sit down and be relaxed to the best of their ability. You see that she has this part of her shirt off, so we wanna make sure that we're on the bare skin. I have my blood pressure cuff here. It's important to have the right size cuff. If you have a too big cuff, it could make your blood pressure seem lower than it actually is, and the reverse. If the cuff is too small, the blood pressure could be higher than what it actually is. So you want, this is called the bladder. We want it to be about 40% of the width of the arm. So this seems like it would be about right. Also, the length is about 80% of the arm. So when we wrap it around, this one is an appropriate size for this patient. So we're putting it, centering it over the brachial artery, and then having her arm rest on the table here, just a little bit above the waist. You want to make sure that the arm's at heart level. So when you're taking a pressure, I'm going to actually explain it to you first and then we'll do it after. So we're going to, first we would kind of do a palpitation. So I'm going to feel over the artery here, and then I would pump this up just to kind of see where I can feel that it stops. It's going to get tight here for a second. Okay, so I felt it around 120, so I would pump it up around 20 to 30 above 120, so when I go to listen, to make sure that I'm hearing it accurately. So this is backwards. I'm going to place the bell of my stethoscope right over the artery. I want to make sure I'm not touching the, any clothing or the cuff. So I'm going to inflate this. So a 30, I'm going to do around 150. Sorry, I'm going to get to it. So then I'm going to deflate this slowly. I'm going to listen for 2 consecutive beats. And then deflate it. Okay, so the first one I was listening for 2 consecutive beats, which I heard around 118, and then it kind of gets muffled, and you want to be listening very carefully for the muffled, and then you're hearing another beat. So the first 2 beats would be your systolic pressure, which I said was 118, and then the second one was around 68. So her pressure would be 118 on 68. So you should wait 2 minutes and then do another pressure, and then take an average of that. You can also do a pressure on the other arm to make sure that you're getting the accurate and same kind of pressure. Okay, so that was my blood pressure video. Thanks, everybody.